Good afternoon. Welcome to Your Health as Well. I'm your host, Dr. Stephen Katz, alongside my two co-hosts, Dr. Hannah Lindsay and Dr. Loreena Ryder. Our office is Naturopathic Physicians Group. We are located in Scottsdale, Arizona, and we are here each and every week to help navigate your journey to wellness. But we like to do it simply without all of that horrible, confusing medical terminology that everybody hates. We're here to provide practical solutions to your health issues that allows your body's healing systems to do the work for you. It's simple, it's natural, and it works.
Dr. Ryder here with your topic of the day. Today we're talking about arthritis. We will specifically be addressing osteoarthritis, but we'll talk about some other forms of arthritis as well. And what is arthritis? That word is thrown around a lot. It is inflammation or swelling of one or more joints. There are over 100 conditions that can affect the joints, and this includes the tissues around the joint as well. That's considered all of the joint, the inside and the surrounding tissue, and other connective tissue as well.
So, hi everyone, this is Dr. Lindsay. There are a lot of different types of arthritis, but some of the more well-known arthritic conditions, we're going to kind of go through those one by one. So, osteoarthritis, this is the most common form of our arthritis. It occurs most frequently in the hands, the hips, and the knees. Some refer to this as the wear and tear type of arthritis, so typically seen later in life just due to the wear and tear of using the joints. There's also rheumatoid arthritis, or RA. This is an autoimmune inflammatory arthritis, and this is a condition where your body, your immune system, is actually attacking its own joints.
And one of the most common ones people will hear about will also be gout and gouty arthritis. Very painful. Most common place you will feel that pain will be in the big toe, but it can be any joint out there. But this one tends to usually show up as one joint. So if you randomly have pain out of nowhere and it's like a 10 out of 10 pain, and especially if it's in the big toe, very possibly could be gout.
There's also psoriatic arthritis. This is a chronic inflammation of the skin and the joints that causes pain, stiffness, and swelling in the affected joints. It also generally comes along with psoriatic patches or rashes, but the arthritis may still occur whether you have a rash or not.
With this episode today, too, we're going to talk a little bit about all these arthritis forms, but the main one we're going to talk about when it comes into treatment is going to be the osteoarthritis, which is the wear and tear, because frankly, if you're over the age of 40, you probably have this somewhere in your body. It's just a fact, and if you get a scan done, I don't know if I've ever seen a scan by somebody somebody older than 40 that didn't have some arthritis somewhere in their body. So super common. If you live long enough, you're going to have this.
Yeah, and I'm often shocked whenever I ask a person over 40, do you have any joint pain? And if they say no, I just pause and wow.
Liar. No, we don't do that.
It's rare.
It is rare.
So what are some of the symptoms of arthritis? Osteoarthritis specifically, of course, is going to present with pain. Pain with movement is pretty typical. You might have headaches due to weak ligaments. Pain is typically going to be worse with movement. If you think about it, it's wear and tear. So the more you move, the more you'll feel the pain. Typically, it can affect sleep depending on how severe it is. And it usually gets worse over time. It gets worse the more that you use it. Go ahead.
No, it's okay.
I was just going to say, if you have stiffness in the morning, oftentimes it's going to feel better in the morning, but as the day goes on and you have more wear and tear, the pain is going to increase. So the more you use the joints throughout the day, the more the pain increases.
And if you ever have broken a bone, it's very likely in the joints around that break, you're going to develop arthritis. And I mean, that was something I heard when I was really young too, and I didn't understand that at the time because I'm like, I'm a kid, I'm going to break a ton of bones. And I've broken my fair share of them over the time. But yeah, you definitely develop some weakness in the areas around your breaks as you age. And like I said, that's the wear and tear side of it.
Yeah, unfortunately. Let's talk about rheumatoid arthritis for a little bit here. So this is an autoimmune arthritic condition where Your own body, unfortunately, attacks itself, specifically at the joints. But there are other parts of the body that are associated, such as your brain. So you may end up having some brain fog with arthritis. You could even have dry eye, glaucoma, or conjunctivitis, or even dry mouth. So there's so many other aspects to an autoimmune disease, and that's just a few that's associated with rheumatoid arthritis.
It's also common in RA to have abnormalities in your fingers and your toes. A lot of times you'll have that symmetric joint involvement, and you could have abnormalities as the joint is swollen. They might kind of curve in. You could also have cold hands and feet, numbness. You might have corns and calluses. Since it's an autoimmune process, it does affect the whole body, like Dr. Ryder was saying. So it can affect the GI tract, your cardiovascular system, and ultimately can cause bone damage and bone weakness.
And one of the things, again, RA is autoimmune, as Dr. Ryder said. When you have autoimmune conditions, your system's attacking itself. So if you have the only symptom you have is joint pain, it's very unlikely it's going to be RA. You're likely going to have other symptoms. If you do have a different autoimmune condition, such as like Hashimoto's or lupus or any of the other autoimmune conditions out there, then you start getting joint pain. That would be when you would kind of circle this wagon. But very rarely is it, unless you start having the known deformities of RA, it oftentimes is something else. However, if you get to the point where you start having the known deformities, like if you start getting the nodes in your knuckles, where your knuckles start to deform, you very likely are going to have a diagnosis of that long before that starts to happen.
Yeah, RA can be really debilitating for people, especially if you start getting it in your younger years. It's really frustrating for people, the pain and the restriction that goes along with it. But we'll talk about some remedies and some naturopathic treatment options later on in the show to help you out with that. Let's talk a little bit about gout. So you had said earlier, gout is affecting one joint. Gout is something that is very painful and not fun if you end up getting it. And again, we'll talk about some preventative strategies for that later. But if you have sudden severe joint pain, the joint will likely be red and swollen, painful to the touch, or even not to the touch. You might end up, it's going to be pretty ugly, actually. You might end up with a mild fever. Yeah, it can be ugly. And then any other joint stiffness as well. But this is typically just localized to that one joint, particularly the big toe, but can be knee, can be elbow, can be somewhere else.
And this one hits 10 out of 10. Like out of nowhere, you wake up and you're like, all hell just broke loose on my joint. And it's usually caused by buildup of uric acid into the joints. So oftentimes, if this is the symptom, your doctor will run a uric acid test, and if it comes back high, then it's likely gout was the cause. But gout is generally diagnosed just from looking at it, what they're telling you, and the severity and how quick the onset was.
And we did do an entire episode on gout. So if you wanted to know more about gout and how to treat it, you can always find our previous episodes on our podcast. So thanks for tuning in. After this quick break, we'll continue talking about arthritis.
Welcome back to Your Health is Wealth here on Money Radio, 1510 AM, 105.3 FM. We're live today and every Friday at 1 p.m. Today's topic is arthritis and how to become pain-free again. Hopefully.
That's cool.
Yeah.
So every single week I do a segment called What Isn't Your Doctor Telling You? It's not an anti-doctor segment. It's just if you don't have an appointment that lasts more than 3 minutes with your physician, it's going to be very difficult to get your questions answered, and therefore you will likely be missing some quality information. Therefore, I like to give a tidbit every week so you can hopefully get better. This week I'm going to talk, since we're talking about arthritis, and again, predominantly we're going to talk about is osteoarthritis, which is the wear and tear arthritis that everybody gets as we age. So I'm going to talk a little bit about misdiagnosis. So when you go to your doctor, whether it be an orthopedic doctor, whether it's your primary care, and your chief complaint is pain, you have to really be detailed with them. The problem is oftentimes the doctor does not do their due diligence for you. You tell them you have low back pain. Oftentimes they don't even do a physical exam with you on the table to actually find out where your pain is coming from. What they usually will do at that point is, okay, we'll send you for a scan, either an X-ray or an MRI. Without doing that physical exam, you'll have no idea whether or not whatever shows up on your scan is actually causing your pain. And a perfect example of this is when they do a low back scan, they always do a lumbar MRI when they check it. And again, if you're over the age of 40, there's very likely going to be some form of at least mild or moderate arthritis in your lumbar spine. So if you go get the scan done and it tells you have arthritis in there, they're going to start treating you based on that arthritis in your lumbar spine. But the three most common spots people have low back pain are your SI joint, your iliolumbar ligament, and your glute tendons. Those three spots are never looked at on a lumbar spine. So if the doctor does the MRI, sees arthritis in the lumbar spine and starts treating you there, but then if your pain is coming from the other spots, you're going to be getting treatment in an area that's not going to help you. I know that seemed like a lot, but the truth is this happens a lot. This is a very common problem that happens, and they start injecting in areas that are not causing your pain, or they start treating you in areas that aren't causing your pain. So if your doctor does not actually do the physical exam, there's a good chance you're going to get a misdiagnosis, and your only treatment's going to be based on the scan and not based on you and where your pain's actually coming from. Bam.
It goes back to just individualizing treatment. A lot of people will have similar things on scans, but their pain could present very differently. So what are the traditional diagnostic tests when we're talking about arthritis? What would your conventional medical doctor order? X-rays and CT scans are pretty common. They both are going to use a small dose of ionizing radiation to produce images. An MRI scan is a little different. It uses magnets and radio waves to create the images instead of the ionizing radiation. So you're not going to be exposed to the radiation when you have an MRI scan, unlike a CT or an X-ray.
So an X-ray, let's talk about that for a minute. It's quick and easy and cheap. So that's typically the first line of imaging that's done. This does send radiation through the body. So it shows areas with high levels of calcium, which is bones and teeth. That blocks the radiation, causing them to appear white on the image. That's how you're able to see the image. Soft tissues pass right through the radiation, so they appear gray or black on the image, unable to see those as easily. So an X-ray is best imaging for things like fractures, dislocations, joint space and misalignments, things that show bones and teeth. The arthritis is much higher in a condition, EDS, Ehlers-Danlos syndrome. Did I say that right?
Yes.
Especially young aged patients. I actually Googled that one time for the pronunciation because I felt like I was saying it wrong. But I must be saying it right. If you say so.
Maybe. But basically, an X-ray is usually the first line. They're going to send you out for an X-ray. Even if you're going to ultimately need an MRI, the doctor's likely going to have to, if you're going through insurance, going to have to get approval of that. And insurance companies never want to send you for an MRI right away. They always want to do an X-ray first. But if it is soft tissue issues or muscle, tendon, ligament issues, the X-ray is going to almost be useless to you. But you also have to be careful, though, because X-rays show arthritis. And again, if you see the arthritis, that doesn't mean it's the arthritis causing your pain. So you still have to be careful on using that as your sole diagnostic means.
So the next step up would be a CT scan or computed tomography scan. This is going to send radiation through the body like an X-ray. However, it's going to offer a much higher level of detail. It creates a computerized 360-degree view of the body's structures. So this is going to be best for small fractures that are not visible on standard X-rays, good for blood clots and certain organ injuries as well. So basically similar to an X-ray, but much stronger, much more detailed.
I was pleasantly surprised when my youngest daughter had broken her foot and I did not have health insurance at the time. When I went to get her an X-ray, it was only $35.
Yeah, X-rays are cheap.
I thought I was going to go bankrupt over
Well, if you tell them you're paying out of pocket, they're cheap.
Right.
If you let them bill the insurance, I don't know
And
what the bill is.
At least 3 times the amount.
Yeah, at least.
Okay, so let's talk about MRI. So this MRI is short for magnetic resonance imaging. There is no radiation involved in the MRI because it uses magnets to pass radio waves through the body. The body reacts to the energy and creates detailed pictures of the body's structures, including soft tissues, nerves, and blood vessels. The invention of the MRI was really cool. This is best for spinal injuries, compression on nerves, any loss of cartilage, any muscle tears, arthritis, any strains or sprains that you would not see on an x-ray, and any tendon injuries.
This is a big box. You walk into a room, the box, you basically get pulled into a box, and then you hear loud banging noises for the next however long your MRI is. So I'm very familiar with these recently. I've done a few of these in the past few months. That's not my favorite thing to do. I don't really want to do it very often if you can avoid it, but it is an awesome machine. It takes amazing pictures, shows you exactly what's wrong if there's tears or soft tissue injuries, tumors, etc. However, like I said earlier, though, you can't use this as the end-all be-all when it comes to soft tissue injuries. You still have to do that physical exam because MRIs show damage, they don't show weakness. Weakness can lead to further damage. So if all you treat is the damage and ignore the weakness, you're likely going to not heal 100%.
So what do you have to say to those people who are concerned about getting an MRI due to fear of enclosed spaces?
What do I have to say? Suck it up. No, I'm just kidding. No.
Is it that bad? Is it?
No, it's interesting. Like a really good MRI place, they're going to give you something to block some of the sound because it's really loud. The way I do it, because I'm not claustrophobic, it doesn't bother me too much, but I still close my eyes before they actually wheel me in, and I make sure I keep my eyes closed the entire time, because I think if you open your eyes at that point, you'll actually get that feeling of that enclosure. So that seemed to help. I did the ABCs in my head over and over again as well. And I don't think I ever did my ABCs that much since I was in kindergarten. So, but it did pass the time. I tried to do music in my head, think of like Rolling Stones or Guns N' Roses, try to think of some good songs, but it's loud, so it's really hard to get the tune and everything like that.
So you resorted to Sesame Street.
So I resorted to Sesame Street, ABCs. And I also, I did it in 3 languages, actually. It helped a lot. So ultimately, you kind of get through it. There are places where the doctors will offer you Valium, to give you a low-dose Valium. But of course, since that is a sedative to you, you're going to need someone to drive you back, or you're going to be all over the road, and we're definitely not advocating that. People do that on their own without the Valium now.
You could take a little magnesium or something before. Valium seems a little intense.
Oh, but the thing is, if you're given magnesium and it doesn't work for them, they're going to go full on panic in the room too. So oftentimes the doctors will, I'm not saying it's right or wrong, it's just saying the doctors will prescribe a low dose Valium just to make sure that they're going to be okay during the machine.
I've had one before, and I felt the hardest part was just staying still. I don't think it's difficult to stay still when you're not thinking about it, but when you're laying there and you know you're not allowed to move, it's all I could think about. I was worried about moving, but
I've heard that before from patients as well. Scans are really great at diagnosing damage in the injured area, but if it's weakness of the tendons and ligaments that is causing the arthritis, then weakness doesn't show up on those scans like you said before. So that's what we are really great at, is treating the cause of the problem and not just treating your symptoms.
Yeah, we're going to treat the arthritis too. We don't ignore if this shows arthritis, you still want to treat it. You just don't want to only treat the arthritis. You want to treat the area, you want to treat the body and make sure that they're not just going to feel better for a short period of time. You want them to heal.
We are talking today about arthritis and how natural treatments can be used to decrease your pain and get your life back.
Dr. Ryder here with your tip of the week. Since we are talking about arthritis, I thought it would be a good idea to educate you on types of collagen. So collagen is our body's primary building block of skin, muscles, bones, tendons, and ligaments, and any other connective tissues. There are 5 types of collagen. Now, this is really difficult, so pay attention. type 1, 2, 3, 4, and 5. Kidding. So type 1 is the most abundant type of collagen in the body. It makes up 90% of your body's collagen. Type 1 is densely packed and used to provide structure to your skin, bones, tendons, and ligaments. And defects in type 1 collagen are linked to that connective tissue disorder, EDS. So type 2 is probably what you would be purchasing in those powders in the store. This type is found in elastic cartilage, which provides joint support. Type 3 is found in muscles, arteries, and organs. Type 4 collagen is found in the layers of skin, and type 5 collagen is found in the cornea of your eyes, some layers of the skin, hair, and tissue of the placenta. So with arthritis and with joint issues, it is important to remember that type 2 collagen is the most effective collagen for joint health. It's the main component of that joint cartilage. Now, that powdered collagen that I was talking about that you purchase in the store, some contain type 1 and type 3 as well, but primarily it is type 2. It's super easy to incorporate into your diet. It's powdered and it goes well, it dissolves really well in hot liquid, like coffee, tea, whatever you're making that's hot. And it also is an added bonus to add more protein into your diet if that's something you're trying to achieve.
So what do traditional treatments look like for arthritis? Typically, they're going to be putting you on some form of painkillers, anti-inflammatory medications, steroids are used a lot, oral steroids as well as steroid injections, corticosteroid injections, and then surgery is ultimately kind of what happens as you go down this path of if the medications don't work anymore, ultimately surgery is your decision. But why are these treatments not the best? Why are they not ideal? Opiates and painkillers. Tylenol is very often recommended for joint pain. Although it is not great for your liver, it does not slow down healing like other over-the-counter pain meds because it's not anti-inflammatory. So anti-inflammatories, we'll talk about those in a bit, they will actually affect the healing process, whereas Tylenol does not. Narcotics such as hydrocodone and oxycodone, these are very addictive. There's a huge opioid epidemic. They're addictive and one of the leading causes of deaths in the country. So putting people on these strong pain medications for chronic issues over a long period of time can be a big issue.
So when you're talking about like anti-inflammatories, like ibuprofen is the most common one. When you're thinking about anti-inflammatories, they shut down the inflammatory pathway. So if you're in pain, you think, that sounds like a good idea. However, the injury that's there is not healing during that. Our body actually uses inflammation as part of the healing process. It's a signaling agent to our immune system to say there's a problem. It's why you swell up when you bang your knee or bang your elbow. That inflammation is a trigger to heal. So when you do chronic use of anti-inflammatories, although you do feel better at the time of taking, the injury is getting worse underneath. And that happens especially when you're using like ibuprofen every day or steroids. So that's why you have to take it every day. And oftentimes, as the injury gets worse and worse, you have to take higher and higher dosings to get the same effects. And it's because the injury is getting worse and worse underneath as well.
There's also steroid pills and injections. This is something that's pretty common, and we see a lot of, like prednisone or methylprednisone or cortisone. This is typically the first line of the conventional medical system if you have joint pain. So it does, just like the anti-inflammatory oral medication, it does help take the pain away. So why would that be a bad thing? Number one, it weakens your immune system. It's not a good thing to have steroids in your system. And even the traditional medical doctors will tell you we can only do this for so long. It's just not good for the body. It's just a very too strong of an anti-inflammatory for over time. And it makes your injury worse. It might take your pain away, but it actually contributes to joint degradation down the road, which would mean either more steroid injections or surgery if you're going the traditional conventional route.
Yeah, as you were saying, like they usually say don't do more than 2 or 3 of these injections in a certain area. And patients will say, felt better the first time for like 6 months, 9 months, a year. Then the second time it was like 3 or 4 months. And then the third time it barely worked. Well, the injury is getting worse as you're doing it. So it's actually weakening those tendons and ligaments every time you do it. And therefore, the injury is going to get worse. Ultimately, if those tendons, ligaments, and joints are getting worse and worse, it's going to increase the risk of needing surgery. So if you get into this pathway where, oh, here's your anti-inflammatory, here's steroid injections, you're basically taking those steps ultimately towards surgery. And surgery itself only has, about a 50% success rate, give or take the type of surgery you're doing. And with structural issues, whether they're doing fusions, whether they're putting rods and pins in you, whatever they want to do now, that's going to show up in your grave 200 years from now that won't degrade. But basically, as your body gets the surgery, the rest of your system has to adapt to that. And so oftentimes you start to hurt in areas that were around the surgical part that were never addressed in the surgery. So then you ultimately need another surgery. So it's a bad pathway. Granted, it can be a game changer for people too, though. If you're in that much pain and it gets you out of pain for a few years, you're happy. But again, if there were things you could do that could have prevented the need for surgery in the first place, wouldn't you have wanted to do that first? And if the pathway starts with steroid injections and painkillers, you're definitely getting put on the path to surgery and not on the path of preventing the surgery.
So what does naturopathic testing look like? As we've mentioned before, the most important thing is going to be that physical exam. And we can use diagnostic testing like ultrasound, MRI, and CT scan. Those are valuable as well. But ultimately, we really want to get to the root cause of the pain, what's truly going on. Regardless of what the scans say, the physical exam is a huge piece of that.
Let's begin our talk on treatment options, naturopathic treatment options that we like to use at a Naturopathic Physicians Group. And this is pretty simple. Just keep moving. A body in motion stays in motion. Participating in joint-friendly physical activity. And that's going to be things like swimming and things that are not like you're not pounding the pavement, running a marathon or jogging down the street with your dog. Joint-friendly activity can improve your arthritic pain. It can also improve the function of the joint. It can improve your mood, which a lot of us need, and also your quality of life. So I don't know. Do you guys think pickleball's a low impact activity?
With the amount of people I've seen playing pickleball now, it definitely can be tough on the joints for sure. But it's better than sitting down watching TV all day and rotting your brain and still getting arthritis from that too.
Yeah.
But ultimately, the term we always use with people is we want you to use it, we don't want you to abuse it. And what that means when it comes to abuse is different from person to person. If somebody's used to training for a marathon and doing a marathon, it can be beneficial when they're doing their normal exercises. But if you're a person that never exercises at all, and then you try to go 0 to 60 in 2 days, you're going to feel that. You're going to break your system down so much faster that you're going to end up quitting because you're going to be so sore afterward. The best thing to do is really kind of slowly implement new new activities in your exercising and build that strength and then keep increasing.
And there's a lot of low impact things you can do as well. I love like water aerobics, which sounds like it's going to be all old people at your gym, but I do it all the time. It's very fun, very light on the joints. You can even biking it's going to be much easier on the joints because it's not weight bearing. So there's a lot of activities you can do, ways you can be active and still use the joints without continuing damage that might be happening with osteoarthritis.
I always feel like I'm one of those old people at the gym. It's actually worse because I'll go there, and when I go to the gym, I'm not doing crazy weights or anything like that. I just do the regular exercise. I'll do some of the bike, I'll do the swimming, I'll do basketball, I'll do the things I enjoy. I never weightlift. So I'll see these 60, 70-year-olds like pounding weights, and it's just like, wow, that's amazing. And I'm like, I'm doing the bike. We're good.
I'm imagining seeing Dr. Lindsay like mixed in with the Silver Sneakers group at the water aerobics class. And
That's my dream. That's where I belong. I would much rather work out with them.
I know, they're great.
We're here today to discuss different topics on health and natural ways to treat them. Today we are talking about arthritis.
So if we're talking about how steroid injections lead you to surgery, what can you do to prevent surgery, or what can you do to heal? There's a lot of treatments out there known as regenerative injection therapies, and we do multiple levels of this in our clinic, and these treatments are the exact opposite of how steroids and anti-inflammatories work in your body. We actually use inflammation. So it sounds like the stupidest thing ever invented, right? We're in a lot of pain. Let's inflame the area. Like, it makes no sense. But if you understood how your body works and how your body heals, it makes total sense. So as we age, the inflammation in these chronic injuries goes down. You actually feel less swollen than you did, but the injury's still there. You still have all the pain. Our body no longer has those signals to the immune system to say there's a problem. So the injuries are getting more wear and tear and worse as we age. So what we do is we use treatments to signal the healing back to the area so you can start to heal.
Prolotherapy is one of those modalities, and this is a injection made of dextrose, lidocaine, just to make it nice and cushy for you, and a little bit
so you don't hate us, you can be honest.
So you come back.
You come.
And some B vitamins, some B12. So this actually stimulates that inflammatory healing process that Dr. Katz was talking about. So what we do is inject that prolotherapy solution into the joint and into the surrounding tissues of what is bothering you. Now, you might hate us for a couple of days and be in pain and swollen, but honestly, it's much better than feeling that pain for the rest of your days. And
it's not typically worse than you're normally just feeling in general, but sometimes you'll have people that say it was really sore afterward. But most of the time, we call it the downtime. It's usually for anywhere from 1 to 3 days after, where your body feels a little bit, it feels inflamed, it's sore.
Compared to surgery, where you have 4 to 6 weeks of downtime.
And months of
recovery,
PT or rehab.
Yeah.
But when you're doing this, when you inject, the glucose, being sugar, is inflammatory. Like I said earlier, that physical exam we do is so vital to figuring out what hurts. It's not just about the scans. Yes, we use scans, we use MRIs, we use x-rays, but it's really that physical exam. When we do the exam, we find the exact locations of where your pain is, and we inject those areas, and it sends the signal to the immune system to say, this is the problem that needs to be fixed. The body sees that inflammation and it sends blood to the area, hence the inflammation. But our immune system carries predominantly through the blood. So it's starting to send the immune system to the injured area. It's amazing how many treatments how many people we can heal with this treatment, because we're using your body's healing systems correctly.
So the next step up from prolotherapy when it comes to regenerative injection treatments is going to be PRP, or platelet-rich plasma therapy. So, if and when prolotherapy doesn't quite cut it, this is going to be our next option. So we're kind of skipping a step in what Dr. Katz was just explaining. So instead of using the dextrose as a signal to bring the immune system, the blood, to the area, instead, we're actually going to draw your blood and we're going to spin it down. We're going to extract the platelets, which is why it's called platelet-rich plasma therapy, because that's what we're injecting. We're injecting your platelet-rich plasma into those same exact areas that we find on the physical exam. So it's a stronger treatment, because instead of signaling the body to send platelets, we're extracting the platelets and we're putting them exactly where they need to go. So we're just redirecting the body's natural healing process, and we're giving a good amount of those platelets and that blood flow to areas that typically don't have good blood flow, like ligaments and tendons and joints.
So oftentimes patients will how do you know what is the right treatment? That's partly what we discuss during the visit when you see us in the office, because until we see the scans if they were done, or we do the physical exam and talk to you about your injury, how old it is, the type of pain you're having, scale of 1 to 10, is there radiation of the pain? All of those things kind of help us guide what the correct treatment is for you. If it's soft tissue like tendon, ligaments, kind of a newer injury, maybe mild arthritis, prolotherapy most of the time is going to take care of that by itself. But if you start getting into something, I've had this injury for 10 years, it's getting closer to bone-on-bone injuries, moderate to severe arthritis, maybe a minor tear, a small tear, that's when you generally start with something stronger like PRP. But when we say it's stronger, easily PRP is 3 to 4 times stronger than prolotherapy. But again, that doesn't mean prolotherapy won't fix your injury. It really just determines, or we just determine based on when we see you in the office and do that. But we've had many people who have seen orthopedic docs that go, they tell me I need surgery. They're telling me I need a replacement or a partial or anything along those lines. And then I'm like, let's try this first. And we try the treatment and they end up never having surgery. So again, we're using your healing cells directly. It's an amazing treatment. We have treated so many arthritic patients and we have prevented so many surgeries. So it's just awesome.
Yes, and we have another procedure that's even stronger than the standard PRP. It's called Excel. This is beneficial for people who might be a hard stick when it comes to getting blood, because we don't need as much blood from the patient as PRP. Also, if somebody's only wanting one treatment as opposed to a series of maybe 3, then Excel would be your option. Now, it does cost more, but like I said, it is only one treatment, and it seems to be very effective.
Yeah, a lot of people do ask how many treatments do you need for these. Remember, these are healing treatments. They're not Band-Aid treatments. So when someone does a steroid and they do it, and then 9 months later they do another one, and then 5 months later do another one, remember, your injury is getting worse and worse with each injection. We're actually trying to heal with each injection. So average amount of treatment start to finish for most people tends to be in that 3 to 5 range. But each time we do it, we push the next treatment further out. So we're going to do the first one, see you a few weeks later, and then usually after that, it's even more time in between the second and third treatment. At that point, oftentimes people are done after 3, and I don't mean like Band-Aid approach, like their quality of life is back and they're holding their grandkids again, they're playing their pickleball again, they're actually healing. And it's an amazing thing to see. We've had people walk in using a cane for a decade. After a couple treatments, they're no longer using their cane. So it's an amazing procedure.
So all of that being said, if you are very anti-needle or you can't fathom the idea of getting an injection into your joint, we do have another option for you. So we have something in our office that we do called shockwave therapy, focused shockwave therapy. This is going to be a non-invasive treatment that involves the delivery of shock waves to the injured soft tissue. So it kind of looks like an ultrasound. We just use it over the damaged joint. We also can use it even on pelvic floor muscles. They can be strengthened through a few sessions of shockwave therapy, so we can use it for urinary incontinence. Also a great treatment for erectile dysfunction. A lot of options with it, but specifically with joint pain, it's going to stimulate healing cells and blood flow to the injured area. So it can create quicker healing, and it also can pair really well with the other regenerative treatments.
Alrighty, we hope you enjoyed this episode on arthritis. Thank you for tuning in to Your Health is Wealth.